Hey everyone, welcome to Blooming. In this video, we will learn about the menstrual cycle and also see a few important one-liners asked in the FNG exam based on the menstrual cycle. Menstrual cycle is a basic topic in the gynecology, and if you do it, you will be able to solve a lot of questions easily. So let's start the discussion. Menstrual cycle is classified into two phases, the follicular phase and the luteal phase. And the hormones involved in the menstrual cycle are the estrogen, LH, FSH, and progesterone. The LH, FSH comes from the pituitary and stimulates the ovary to give the estrogen and progesterone. The LH and FSH both act on the granulosa cells present in the ovary, and the LH gives progesterone and FSH gives estrogen. So this is a very important point which you need to remember. So moving on, in the follicular phase, the estrogen is dominant, and in the luteal phase, the progesterone is dominant. One liner asked previously. What is the function of the estrogen? Estrogen acts on the ovarian cycle and causes the proliferation of the endometrial glands occurs in the presence of the estrogen. As we all know that the menstrual cycle, normally it consists of 28 days. The first 14 days are the follicular phase and the next 14 days are the luteal phase. So in the first 14 days, the estrogen is predominant and in the subsequent progesterone is predominant. Then on the 14th day of the cycle, there occurs the ovulation, release of the ovum. And the factor responsible for this is the LH surge. After the ovulation, the luteal phase starts, and in this stage, we've already discussed that the progesterone is high. After the ovulation, the mature follicle turns into the corpus luteum. This corpus luteum will release the progesterone, and this progesterone helps in making the endometrium secretory and makes the endometrium prepare for the implantation. Fertilization happens on the day 14. If there is fertilization, then there will be implantation happening. And if there is no implantation, then on the day 28, this endometrium will shed off, causing menses. So this was an overview on the menstrual cycle. So that's a certain important one-liners asked in the FMG exam. A very famous question asked is when does the ovulation occurs? It occurs 14 days prior to next menstruation. Repeatedly question is asked on this. Then moving on, ovulation occurs due to, as we have discussed, that it occurs due to the LH surge. And the cause of this LH surge is the estrogen. Questions are asked how much estrogen is required to cause the LH surge. The answer is 180 to 200 picogram. Then the proliferative endometrium is caused by the estrogen, and the secretory endometrium caused by the progesterone. Another repeatedly asked question is maximum activity of the corpus luteum is seen at what days? So it is maximum at the day 9 and 9 to 10. And complete generation of the corpus luteum occurs on the days 14 to the day 15 or the day 15. Then the next question, first histopathological evidence of ovulation. When we take the biopsy and look it under the microscope, we will find subnuclear ovulation, and this is the first histological evidence. And moving on, the first polar body is released at the puberty or the ovulation, and the second polar body released at the time of the fertilization. So we have discussed that during ovulation, the follicle ruptures. And what is the exact size needed for the follicle to rupture? It is 15 to 20 mm. And if the size is less, then there will be no rupture of the follicle. And this defect is seen in PCOS, a very famous question. And the frequently asked question is, when can we take the endometrial biopsy? So we can take the endometrial biopsy pre-menstruation, before the menstruation occurs, or we can take it post-ovulation, after the ovulation has happened. And if you want to know the numbers exactly at what dates, then it is 20 to 30 days. In between these, we can take the endometrial biopsy. 21-liners are also asked, but if they want to make the question lengthy, then they can give a clinical case kind of a question that female has come for the examination and when will you take the endometrial biopsy? So the answer is premenstruation. So let's discuss another few basic questions related to the menstrual cycle. Like, what is the fertile period? It is 11th to 16th day because on 14th day, if there is ovulation, then within 24 hours, then it will be fertilization happening. And the sperm can survive in the female genital tract for the 48 hours. So the 48 hours before and after the ovulation time, these are called as a fertile period and is 11th to 16th day. So this was a brief discussion about the menstruation. One question every year is asked on this topic, either one-liner or clinical-based question. They can ask that the giving the LH and the FSH hormone, the regulation when involving the pituitary and the hypothalamus, their action, or they can give this chart kind of a thing and mark anything in the question and ask you to identify it. So it is a must do topic for the FMG exam. Thank you guys, that's it in this video. If you like the video, please like and subscribe to my channel and also share it with your friends. Hit the like button and also tap the notification on.